There was a lady who had a postpartum hemorrhage, and they called us around 2 in the morning, and they weren't sure if they were going to maybe consider hysterectomy or what they were going to do, so they asked us to embolize her. So it was a quick procedure, maybe half an hour in and out, and the next day she was fine walking around.
A man who had a terminal cholangiocarcinoma, and family really wanted him home for the holidays, and really he wasn't going to be making it home without a drain, and it was a tricky procedure. But I inserted a percutaneous biliary drain, and he was able to go home for the holidays.
There was a 6-year-old boy that we saw several years back that presented with an acute stroke and had a major blockage and a blood vessel going to the back of the brain. And it's normally a fatal type of stroke. The child wouldn't have survived. And we were able to treat that child using the same kind of stroke techniques that we would for an adult. And now he looks no different than his brothers and his sisters. He's able to run, jump, play. He's part of the cross-country running team.
So there was a patient who had just delivered a child and unfortunately had a lot of bleeding afterwards, ended up going into a coma because of the amount of bleeding. And was too sick to have surgery, would have almost certainly not survived surgery, and they contacted us in the middle of the night. We went in, we were able to block the arteries that were bleeding. She came out of her coma soon after and was recovered and home within a few days of that. And if we weren't there, she would, no question, have not survived.
We recently had a case where a veterinarian fell off a horse and had a intercostal bleed from underneath her rib. She fractured the rib and bled through the artery. So the surgeons in our hospital don't do much chest surgery. So they sought our assistance, and we did an embolization of the artery and subsequently stopped the bleeding, and the patient did well afterwards. And sometime later I was at a fitness class, believe it or not, but I do go to fitness classes from time to time. But that said, she was very grateful and appreciative because she understood that without that intervention, she would have ended up with a large surgery done by perhaps a surgeon who was not comfortable doing that surgery.